There's a condition called retinoblastoma. Can you talk about it a little bit?
Retinoblastoma is one of the most common intraocular tumors in children. It is probably the most common intraocular tumor in children, I should say. If you took the general population, it would probably be melanoma, but in children it's retinoblastoma. Retinoblastoma is a malignant tumor that is an emergency and has to be treated very quickly. It happens in about 1 in 15,000 live births. And it usually is connected to the number 13 gene. And there's some problem with suppressor genes in terms of the way the actual disease basically propagates. The thing about retinoblastoma is it can happen sporadically for no apparent reason and no history of it or anything, and the child might come into you for a routine exam and you'll notice that there's a white reflex in the child's eye, or the parent might notice it. This white reflex or leukocoria has to be examined and investigated very quickly to make sure that you're not dealing with a retinoblastoma.
Can a baby be born with it?
A baby can be born with it, but it might not be seen at the first visit. It might be seen when he's 6 months of age. It doesn't have to be there. The earlier the cases are, the more likely it's a more severe type of case, and it can actually be hereditary form, in a hereditary form. The earlier the child gets it, the more likely it could be hereditary and could be passed on to a child down the line. Now the thing about retinoblastoma is that once it's diagnosed, something has to be done very quickly. The retinoblastoma, as seen in the child's fundus, will be a white lesion that's elevated, and you might see it when you look through the child's eye as a white reflex. If you allow the actual disease to go on, it can spread to distant organs and tissues, and it can actually spread into the orbit itself, and you can get a very serious condition, and when it gets to that extent, usually it's metastatic and it's all over the body. So a child who has spread of the retinoblastoma has a very grave prognosis, certainly needs chemotherapy, but we also worry about distant metastases.
Can the eye be saved?
If we catch the retinoblastoma early enough, there's a number of different treatments that can be utilized today, and some of them have to do with actually delivering the chemotherapeutic agent through a small venous catheter straight into the eye itself, right in the area where the retinoblastoma is, and it can be delivered directly to the eye through the ophthalmic artery. This is a very amazing technique that's been developed over the last few years. They can also be treated by external beam radiation. It can be treated with radiation plaque therapy, cryotherapy, and even laser if it's small enough.
What's the prognosis if it's diagnosed early?
If it's caught early enough and it's a unilateral case, the prognosis can be very good. It might not spread at all and you might never see another problem. If it's a bilateral case, these children have a higher propensity to getting the actual to actually get cancers later on in their life in other locations, sometimes in the lateral distal bones of the body. Also, there's another type of retinoblastoma which is very severe, and it's called a.
How common is retinoblastoma?
It happens about 1 in 15,000 births. The thing you have to determine is to make sure it's not a hereditary form, which can be seen in siblings or passed on down the line.